probably wondering, what's that song? And isn't this 10 minutes to your health? Well, on today's edition, we're going to learn about the medical mission at the Savannah Lamar Hospital during the COVID-19 pandemic. And joining us now via Zoom are Doctors Gary Rule, co-chair of the Jamaica Diaspora Northeast Health Sector, and Robert Clark, president of the Help Jamaica Medical Mission and chief medical advisor to the Northeast Diaspora in the U.S. Good morning, doctors. Thank you so much for joining me.
Good morning. Thanks for having us.
All right.
Thanks for having us.
Dr. Rule, I'm going to start with you. Tell me a little bit about this mission and its primary goal.
Right. So the mission actually started with a collaborative conversation with several lead partners in the diaspora in the Northeast. And what we actually started to talk about was how best to support the health sector, and specifically with the pandemic in Westmoreland, basically Savannah Lamar, and how best to support the health sector there and the persons on the ground.
Yeah.
And so, go ahead.
I was going to ask, why Savannah Lamar?
Right. So at the time, the surge in the COVID cases were really in Westmoreland and concentrated in Savannah Lamar. So we chose that specific area because there were many persons who in the diaspora, healthcare professionals, who actually were at the forefront of the pandemic in New York and elsewhere, wherever they were. And so they thought they could really bring their expertise to share with the folks who were going through the surge at that point.
I like that idea, Dr. Clark, because Dr. Rule is right. Some of the experiences that you would have had in America, some of the exposure to technology and ways in which the pandemic was being treated would have been very useful to us here in Jamaica. So tell me, how did it work? Did you physically come to Savannah Lamar, Dr. Clark, or did you liaise with teams?
No, yes, I was actually the leader of the advanced team that started the mission in October 17th. So I came down just to look at how best we can support Savannah Lamar and its staff, because we know that they were under extreme burden in fighting COVID. They've actually lost some of their colleagues to COVID during the fight. And so it was very overwhelming for them. And so we decided to step up to help as a support staff to help in the fight against COVID. So my job then as the advanced team was to look at the needs and clarify how best we can support them while we're there on our mission in the hospital.
Yeah, and Dr. Rule, one of the things is not just focusing on, I guess, infrastructure. A lot of what the teams did was assist in terms of technical support, patient recovery, and so on. Walk me through that process. Dr. Clark came, they did the assessment. So walk me through the next step.
Right. So I'll also take a step back to recognize that Claudette Powell is the chair of the health sector, and obviously organized under Karen Dunkley, who is representative for the Jamaica Northeast Diaspora. And we're here basically on the auspices of C.G. Wilson, Alcian Wilson in New York. So I'm actually on the ground now at SAV, and the initial idea was to help with triaging persons who are coming in with COVID, really through the entire process. The registration, the testing, the medical care that they need. And you have a lot of nurses who really are the background of the operation. So nurses and healthcare and doctors, some respiratory therapists. And the mission really is from October 17th all the way through December 17th. And we're in shifts of 7 to 10 days. And different teams have up to 10 persons with them. With the decrease in the COVID cases right now, what we're doing, primarily myself and the team that's now actually on the ground, is working with the staff at SAV, mostly in A&E, accident and emergency. And we really do a range of different things and within the scope of our practice. The nurses, of course, will do their nursing thing, vital signs, whatever the nurses and staff needs. We as physicians as well will kind of do the same thing. The other thing I would say that we shouldn't discount the fact that sometimes, like yesterday, what I really did was speaking to persons who are waiting to go to another part of the hospital. And just that one-to-one communication that you have with the residents and the patients, that makes a huge difference with them. We've also done some mutual exchange of ideas, quality improvement, things we've learned. So it's not a one-way event. It's really a mutually respect, and we're exchanging ideas of how best to deal with COVID and how best to deal with other healthcare issues that we're experiencing.
Yeah, the team consists of physicians, physicians' assistants, nurses, nurse practitioners, ancillary staff, administrative personnel. Dr. Clark, people would ask, oh my gosh, you doctors have been working so hard in COVID. Why not take a vacation? Why use your time off to come do a rotation in Jamaica?
Well, thank you for that question. Most of us in the diaspora are diehard Jamaicans who have always wanted to give back to Jamaica. We have been doing that as on the Help Jamaica Medical Mission for many years, coming back on a yearly basis to do medical missions starting from 1998. So this is no new thing to us, indeed. And just to rewind a little bit, when the pandemic started, roughly about 2 years ago, the Honorable Kamina Johnson had reached out to the Council General for us to come down and help, to fight COVID. Mm-hmm. But at the time, we had to quarantine for about two weeks, so it wasn't practical at that time. Mm-hmm. So this time around, the minister again reached out to Council General Alcyon Wilson to ask how best we can come down and help, since there was a surge in Westmoreland. And this is how we kind of put this team together, because the enthusiasm has always been there to come down and help, because even in New York, New Jersey, where I practice medicine, it has been really, really rough on us in terms of fighting COVID. Yeah. We have also lost a lot of colleagues and stuff like that. So we understand the tremendous burden that is placed on the local staff in and around Jamaica, particularly in Savlamar, where there was a surge.
And what you said is very important. I mean, when we look at the COVID statistics, I know people talk about losing family members, but I don't know how many people realize that our healthcare workers have lost a lot of colleagues because they've been on the front line. It's just been amazing to see how our heroes have responded. Dr. Rule, how have we been seeing the effect of this? Because as you said, there is a surge in Westmoreland. You've been here on rotation and your team. How has it been helping with addressing the COVID-19 in that parish?
Right, so thanks for that question, Dahlia. So right now, because of the decrease in the COVID cases, primarily this week that I'm here, we're really helping mostly in the A&E. And then we've also gone upstairs to the medical ward, to both the male and the female ward. And really, I must also point out that this is the reason why this is really powerful in terms of a collaboration, is because it's just not JahJah Foundation and Help Jamaica Medical Mission, right? So a lot of the nurses and the healthcare professionals are also from, there's an LJDR Davis Foundation, OID, MyJack, which is the Midwest Jamaica group, and the Jamaican Nurses Group of New York. So a lot of persons coming in to help where we can, wherever we can, in terms of deploying with the folks on the ground. Mm-hmm. And so wherever we are, we can help. I mean, one person, the feedback we've got, one person came, they needed to have a porter transport the person to X-ray, and they were really, really busy. So even though we're healthcare professionals, we're here to help. And whatever way that we can help the staff, both in terms of personnel, as well as just moral support, that's what we're here to do. We love Jamaica, and whatever you ask us to do within the scope of our practice, within the authority from the Ministry of Health, we will be here to actually assist.
This is very inspiring, gentlemen. And I have to add that even though we're speaking about Savannah Lamar this morning, that you've done lots more within our health sector. You've helped Kingston Public Hospital, you've done stuff in Trelawney, you've helped basic schools in the Grill. So not just this project, but many, many more. And we look forward to just how much more impactful you're going to be. Before we go, any last words from you? I'll take yours first, Dr. Clark.
Yes, I would just give a big shout out to the staff of Savannah Lamar Hospital, who have really welcomed us with open arms, and they've collaborated with us. We have done some teaching, they have done some teaching. So as Dr. Rule pointed out earlier, it's a symbiotic relationship, and we fit in very, very, very good. This is a historic mission. We have never ever had anything like this before coming into the hospital system and trying to help our colleagues. It is a very, very rewarding job for us, and we really thank the ministry and all the partners, including the Counsel General Wilson and the Honorable Minister Kamina Johnson, for reaching out to us to come in and help our colleagues in Jamaica.
Excellent. And you, Dr. Rule?
Right. So I think the power of this mission really is a collaboration, not only from the Northeast diaspora, but we reach the persons in the South, in the Midwest, and the West to actually do this mission. So that's the power, I think, of the collaboration. I think part of the issue with COVID and why the mental issue has been so much for folks is that sense of isolation and not feeling like you have any help. And I guess the last thing I'd say to persons who are listening is that you're not alone. When you're going through that crisis, that's what we are there for, to help each other. And so I just tell the staff and the persons of Jamaica, that's why we're here. Reach out, you're not alone, and really help is available.
Listen, this morning we were talking about great moments and that they don't happen suddenly. And I feel like ingrained in all of us as Jamaican people is the idea of so that Jamaica may increase in beauty, fellowship, and prosperity. And we pledge the love and loyalty of our heart, and I see that exhibited this morning. It's an honor speaking to you both, and thank you so much for all you do.
Thank you for having us.
Dr. Gary Rule, co-chair of the Jamaica Diaspora Northeast Health Sector, and Dr. Robert Clark, president of the Help Jamaica Medical Mission and chief medical advisor to the Northeast Diaspora in the U.S. That's 10 Minutes Dear Health. We'll do it again next Thursday.